Thank you everyone for joining today's info session. We want to welcome everyone to Mount Sinai. My name is Ruth Mendivelso, onboarding specialist with the Department of Volunteer Services at Mount Sinai Hospital. Joining us today is Ashley Isman, one of our employee health nurses who processes the health clearance for all volunteers and observers. She will provide tips and more information about the health clearance process. These are the topics we'll be going over today. We'll be reviewing the VSys Live portal account on how to download the health forms and upload. We'll be reviewing the EHS non-employee clearance form, the toxicology screening, the OSHA questionnaire, and then lastly, we'll have the Q&A portion. Everyone here should have access to their VSys Live portal account. The web address is mountsinai.vsyslive.com. And I'm going to show you how to navigate. So once you put the address in your browser of choice, you're going to click on existing user login and enter your credentials. This is same information you use to create your VSys account and submit the application. Okay. So once you're logged in, you'll notice that you have two checklists. The first checklist is your general onboarding checklist with all the onboarding materials. The second checklist is the initial health clearance new volunteers observer checklist, and that's just a breakdown of all the health requirements. Each of the health requirement here has a document with tips on how to complete it. Please note that each of this requirement are just for reference only. Do not download and bring this form to your doctor or any health provider to complete, because if you upload this form with information, it will be rejected. EHS will not review this because it's not the official Mount Sinai forms. These are just for references on how to complete that certain health requirement. So where do you download the official Mount Sinai health forms? Is by clicking on the first requirement from your checklist, which is health clearance. So you're going to click on the link here to get to the page where it has all the information that you need. So once you're on this page, you will see that the first step is to download the health forms. So you're going to click on the link. The first 3 pages are guidelines and more information on how to complete the forms. And you would scroll down to page 4 and 5 titled EHS non-employee clearance form. These are the official Mount Sinai health forms. For the EHS non-employee clearance form, you're going to complete the top section with your personal information. You're going to put your name, date of birth, phone number, email, the department that you'll be volunteering or observing, and your role if you're a volunteer or observer. Then you will check off the facility where you'll be doing your assignment. If you are at the Econ School of Medicine, you're going to check off Mount Sinai Hospital. For the clearance requirements 1 through 8, that is to be completed by your primary doctor or health provider. And you want to make sure that your doctor or whichever is your health provider also signs, dates, and stamp the form. After it is returned to you fully completed, you will need to upload it to your VSys account for review. And in order to upload that, you're going to return to your VSys account and to this page and make sure that the attachment type is selected as EHS non-employee clearance form. You're going to locate the file that you saved to your device and then click upload. And you're only going to upload this once. Duplicate copies will just delay the process. So now I'm going to turn it over to Ashley for any helpful tips on how to complete these forms.
Thank you, Ruth. And thanks everyone for joining. Thank you for taking time to volunteer with us. As Ruth said, I'm Ashley. I'm one of the nurses with Employee Health, and one of our jobs is to medically clear all the volunteers, interns, observers, etc., who come to Sinai. I know Ruth's going to open up a Q&A at the end, but I just wanted to go over some tips that can help expedite and save you guys a lot of time with the medical clearance process, things that I've come across over the years. So the health form itself, Ruth's on it, it's essentially 2 pages. The other pages are just a tip sheet. Despite what the tip sheet says in the first couple pages, you don't have to attach any supporting documents to this 2-page health form as long as it's filled out correctly. And I'm going to go over that with you. So I want to take a look at this number 2, this tuberculosis section. And again, when you bring this form to your doctor, it's their job to, or nurse practitioner, doctor or nurse practitioner can fill this out. Their job to interpret all this, but believe it or not, even they have questions, and I just find the more awareness you guys have, the better. So you have 2 options with this tuberculosis section. I know there's a lot of verbiage, so let's just skip down. See where it says this TST number 1, TST number 2. So your first option is to do a tuberculin skin test. That's what that stands for. It's otherwise called a PPD skin test. So if you're doing the skin test option, you have to do 2 of them if you're going to be with us over 6 weeks, which is the standard volunteer length. We have short-term volunteers that join us and they're less than 6 weeks. So for the standard greater than 6 week length, you need 2 skin tests. So this number 1, Ruth, can you highlight to the right there, the time frame requirement has to be within 3 months of your anticipated start date. And then TST number 2 has to be 1 week after or within 12 months before the above TST. So what this means is that you have to, TST number 1 always has to be within 3 months. The second one, if you happen to have an old skin test that's no more than a year old, no more than 12 months old, we can take that for TST number 2. If you do not, many people do not, then you have to do them consecutively, meaning you'll do your TST number 1 with your doctor. You have to wait 1 week and then do TST number 2. This option is very time consuming, I will say, in total, and it involves a lot of back and forth. It can take up to 3 to 4 weeks to complete 2 skin tests back to back. A lot of people go with this, your second option, which is this quantiferon gold. This is a blood test. So it's just a blood draw, 1 and done. And that, as the parentheses say, that has to be within 3 months of start date. I just want to make sure for the short-term volunteers that are here less than 6 weeks with us, if you are doing the skin test option, just TST number 1 needs to be done. Don't worry about TST number 2. You guys are exempt from that because you're only here with us for such a short time. But if you're doing the blood test, no matter if you're short-term or long-term, it's always within 3 months of your anticipated start date. That chest x-ray option, that is if you've ever had a positive skin test or positive quantiferon gold blood test, those would be considered abnormal results. So then we ask, instead of doing that, you just simply give us a chest x-ray. It has to be within the last year. And you do want to attach, that's a special circumstance, you do want to attach the chest x-ray report for that because we would need to see that you had a normal chest x-ray. Okay. And then let me scroll down. Measles, mumps, varicella, those are pretty, you're either going to do vaccination or blood work. This hepatitis B here, I get a lot of questions on. So you have 3 options as it reads, yeah? You can do the vaccine series or write proof there. So vaccine 1, 2, 3. Doesn't matter the date as long as you have the completion of the series. Your second option is to do this hepatitis B surface antibody titer, which is a blood test, just checks for your antibodies against hepatitis B. And your third option is to decline. Hepatitis B immunity showing that test is optional. You don't have to do it. We highly recommend it if you're going to be in contact with blood and bodily fluids, as that is how hepatitis B is spread. So a volunteer, volunteering in the emergency room or in a lab setting where lots of sharp things are around would be probably more at risk, or I would highly recommend those volunteers to make sure they have immunity. Those who are doing, for example, administrative tasks would be less of a risk. So you don't have to worry about it if it's something that's going to be a hassle for you to, get the vaccine proof and get the blood antibody check done. Okay. Flu shot. Flu shots are still required, guys. Unfortunately, it's just our flu season is different from the general public. The hospital flu season goes much longer than the general public. We have to wait for the New York Department of Health to end flu season for hospitals. Last year, our flu season went until June 30th, the very last day of June. So if you are volunteering or starting your volunteer work before June 30th, then the volunteers, they needed to submit. We haven't gotten an exact date this year on when flu season will end, but I would just advise, that's kind of what we've been seeing is sometime in June it ends. So if you're going to be starting before June, I would still recommend you have a flu shot on board for this flu season. This flu season would be a flu shot anywhere from August 2023 and on. That would be considered for this flu season. And tetanus, okay. Oh, number 8, yes. A lot of people give me perfect applications and the doctor or nurse practitioner forgets to check off yes or no here. And it's such a shame. It's a small thing, but if it gets missed and we can't accept the application. So just make sure if you have a chance to check over your form before you upload it, that this number 8 is done, okay? And I think that's it, Ruth, on the tips. So I'll hand it back to you now.
Thank you, Ashley, for the tips. Now we're gonna go back and continue the health clearance process. So part of your health clearance process is to complete a toxicology test. And you should have received volunteers who will be on site for more than 6 weeks will have to complete a toxicology test. They would have received an email from the Department of Volunteer Services with the subject line, your drug screen cube passport. This email will contain instructions on how to schedule your toxicology test at your nearest Quest diagnostic location. Please schedule your appointment as soon as possible. If it's been more than 2 business days and you haven't received that email, you could message us from your VSys account by navigating over to the message menu tab and click on toxicology request form. You're going to enter the fields and submit. We'll be notified and we will follow up with you. Please note that the toxicology results are sent directly to Employee Health Services and no further action needs to be taken after you complete your toxicology. I also want to show what that email looks like. This is what the email looks like. Again, the subject line will say your drug screen cube passport. It will list the instructions and the link on how to schedule your appointment, and attached to your email is your cube passport. So at your scheduled appointment, you need to bring this document with you, and that's how the staff at Quest will know what to test you on and to send the results to EHS. The cube passport document also has an expiration date, so just be mindful of the expiration date. If you haven't scheduled your appointment before it expires, and it has expired, please email us at volunteerdep@mountsinai.org so we could place another order for you. So I'm gonna hand it over to Ashley for any helpful tips to complete this requirement.
Thanks, Ruth, again. Okay, so the drug talk, guys, bring an ID with you, an official form of ID. A lot of people forget their ID and, the Quest can't perform your drug test without an ID. As the substances we test are written there, and just highlighting again, because I get asked this question, no legalized recreational drugs are tested. And the last thing is a lot of people ask me about prescription medications. A lot of people are on meds for ADHD, for example. So what happens with that, if your Quest tests are in cutoff levels for each drug class, the amount or the dosage of the drug that you're on may or may not trigger a positive result. If it triggers something positive, Quest will contact you directly and ask for proof of your active prescription. They're going to ask you, and if you're going to say, yes, I have it, and they're going to tell you where to submit that. You don't need to submit anything to us at Employee Health. Quest takes care of all that. Again, it may or may not trigger anything. So just keep an eye on your phone. Quest usually calls, I think, from a 1-800 or, 1-888 number sometimes, but they will leave you a message. And yes, as Ruth said, we get the results of your drug test directly. So if you do not hear from me or any of the other nurses regarding your drug test, do not worry, then everything is okay. If we email you, if something needs to be clarified or something popped up on your drug test, we will reach out to you via phone or email. Thanks, Ruth.
Thank you. All right, moving along. So there's a third health item to complete as part of your health clearance process, but it only applies to volunteers who have assignments in the emergency department or working with animals or animal tissues. And if that applies to you, then you'll need to download the OSHA questionnaire form. So it's listed here in number 4, and you're gonna click on the link. A new tab will open, and it's 2 pages. This is a assessment form. You as the volunteer will complete this to the best of your ability, and by the end of the second page where it says to be signed by a physician examiner, you're gonna leave that blank. Employee Health Services, after they receive these forms, will be signing off to that. So once you're done completing the both pages, save it as a PDF, one PDF file, and then upload it to your VSys portal account. Once you return to this page to upload it, you're just going to change the attachment type to EHS OSHA Questionnaire. Then click on the blue dotted box to locate the file that you saved of the OSHA questionnaire, and then click upload once. Again, avoid sending duplicate copies. It will delay the process. Now, this is an important thing to remember. Once all of your health requirements have been submitted, Employee Health Services will review and process your health clearance. This process could take up to 2 to 3 weeks. If anything is missing or an item needs to be updated, Employee Health Services will contact you by email. If you haven't received a status update to your health clearance after 2 weeks of health forms submission, please send us an email to volunteerdeb@mountsinai.org, and we will follow up with Employee Health Services on your behalf. These are the frequent asked questions that we get. I submitted my health form, but notice a section is still marked as incomplete. Please know that it may take up to 2 weeks once a submitted health form is reviewed and approved by Employee Health Services. If you haven't received an update after 2 weeks, send us an email at volunteerdeb@mountsinai.org. How do I get a CUBE passport? The CUBE passport will be sent via email with a list of instructions to schedule your appointment to your nearest diagnostic branch. Once you receive your CUBE passport, you have a month from that day you receive the email before it expires. So again, pay attention to the expiration date on your CUBE passport document attached to your email. Do I need to submit the toxicology results to volunteer department or EHS? No, the results are sent directly to Employee Health Services. No further action needs to be taken. If you do have any health-related inquiries, you are welcome to email Employee Health Services at volunteerhealthforms@mountsinai.org. Another important feature I would like to point out is that once you upload your health forms, and if applies to you uploading your OSHA questionnaire form, navigate over to My Uploaded Documents menu tab in your VSys profile, because that's where it's going to confirm that the form has been successfully uploaded. And there's going to be 2 statuses for only EHS documents. It's going to be either pending or transferred. If it's pending, it means it hasn't been transferred yet. If it says transferred, it means it was transferred to Employee Health Services. So if you want to check, and this applies to any other documents you have uploaded to your VSys account, it will be listed under My Uploaded Documents. However, again, when it comes to EHS documents, it's either going to be pending or transferred. Once your medical forms and toxicology has been approved, the Department of Volunteer Services will receive the clearance from Employee Health Services. We will update your account with that clearance, and then the requirement will say complete, and it will be complete for everything you have completed for your health clearance process. Okay. Again, if you do have any questions, you could email us at volunteerdeb@mountsinai.org. Call us at the line listed on the screen. Drop into our Zoom office hours Monday through Wednesday Monday, Wednesdays, and Fridays from 10 to 11, Tuesdays and Thursdays from 2 to 3. Employee Health Services email address is volunteerhealthforms@mountsinai.org. Thank you again for joining us for this info session. We hope it was very helpful. If you don't have any questions, you are free to go. If you do have any questions, please stay, as we will have a Q&A portion. And before you address your question, please state if you're incoming volunteer or incoming observer.
Hi, I'm Jessica. I put my questions in the chat. Thank you so much for organizing this info session. I'm an incoming volunteer volunteering with the Savvy Advocate Program. I'm curious